introducing our next panel discussion, I want to hand it off to Annika to introduce our next one.
I am thrilled to now introduce a team of phenomenal women who I have had the great pleasure of working with and learning from. Dr. Victoria Breckrich Vasquez is a professor of nursing and health studies at the University of Washington, Bothell, with expertise in community-based public health practices within communities of color in the United States and abroad. Research topics of particular interest to her are Latinx studies, sexual violence prevention, and mindfulness. Sandra Huber began her career as an engineer, but later went on to shift to community-based work. She wears many hats as a community leader, with her primary roles being the Community Engagement Manager for Verdant Health Commission and the co-director of Mental Health Matters. Sandra is driven by her passion of empowering communities of color and developing sustainable programs to support their needs. Lastly, I would like to acknowledge Dr. Jody Early, who is also a professor of nursing and health studies at the UW Bothell campus and is the other co-director of Mental Health Matters. She will not be speaking today, but she helped create this presentation.
Wonderful to join you. Thank you so much for the introductions, Annika. And we're so happy to be here. I wished I could have had a conference like this in my early years when I was trying to figure out what I was going to do for the rest of my life. And little did I know I would be in public health and I'd be doing both global and domestic work. And, you know, all of your passions you can put into a package for yourselves. There is no one to tell you you just have to do this and you don't have to do one thing for the rest of your life. So I hope that we don't really get to talk in this particular presentation about our trajectory, but if you have any questions about that, we're happy to answer those at the end. I'll share my screen now. So today's topic I'm going to share with you is intersectionality and global health. This is of extreme importance that we understand the roles that we have here, and I'm going to do a slideshow here. All right, we are part of the world, right? And we all have multiple identities. And this is a very important topic for all of you with future healthcare careers and public health careers to understand those intersections of identities that impact the people we are going to be serving and working with for the rest of our lives. So this is a little bit about us and our affiliations. And of course, Jody Early should be also part of this screen. She's a really big part of our work and she supports so many different projects. So I'm here on behalf of UW Bothell and Mental Health Matters, as is Ms. Huber. But before we start with intersectionality and go right for the definitions, we're going to start in with a case study because it really is good to kind of think about a global health issue that's of importance and think of then how does that global health issue, how is that impacted by intersectionality? Then we can kind of get into what it actually is. So many of you might have heard that we have unacceptably high rates of maternal mortality globally, both here in the US and in other countries. Women are dying from pregnancy-related conditions way too much, and these are all preventable. The US is actually has the highest rate of maternal mortality of any industrialized country, despite all the health care and services and prevention that we have available. We still have really, really big health inequities there. Black women in particular in the US are at very high risk from pregnancy-related conditions. And we know that in particular for them, racism and for many others, Black and brown women are affected by racism in the healthcare system. If any one of you might this be new information, this is really important to understand that we're coming into a healthcare industry and a public health infrastructure that has been heavily influenced by years and years of racist practice, and where trust is really lacking, right? Trust in our healthcare system is lacking by people, and for good measure and for good reason. Also, we know that women, or Black women, are less likely to go into pregnancy in good health. They suffer from chronic illnesses that are consistently due to lack of access and proper quality of healthcare throughout their lives, right? And then they're less likely to have adequate maternal care when they are pregnant, right? So we need to really think about this. And this is the case even when income and education are equal. So we can say, in fact, there is something else going on beyond social status. Black women are by far the largest demographic in here in the US in particular to suffer these outcomes, and it's been this way for decades. So I'll share with you a real sort of like a story between really what's happening for, say, an LGBTQ Black woman who is pregnant in her first trimester and a white woman who is pregnant in her first trimester. Both are working class, so they're equal in terms of their class status, but when they are seeking healthcare, they are really influenced and objectified differently. Both might experience what we know as gender discrimination, but in fact, the LGBTQ Black woman is also experiencing homophobia and racism at the same time, in addition to gender discrimination. This is the additive effect of these types of identities that is impacting on her outcomes, right? So we are very thoughtful about this in healthcare now, and we're becoming very much more attuned to doing something about this, because this is an intractable problem that needs some solving. I'm going to play for you a video. I do hope it works. I have tested it. Yay, okay, good. It's just about 3 minutes or so, but it gives you kind of an orientation to intersectionality in a way that I think is very instructive. So let's share that now. And I hope the sound quality works, but Annika, you can tell me if something's off with it, yes?
Research has shown us that gender, ethnicity, and social class.
Okay, I think I know what happened. So I need to pause for a second, and I need to go back and reshare this with sound. There we go.
We secure the sound.
Oh,
Yeah,
you could. Oh, you could. Oh, I'm sorry. I was not understanding. Okay.
A strong impact on our health.
Yes.
Yet the simple fact is that no one is just a man or woman, or just black or
The
white.
screen's not changing now.
Just working class or middle class.
Oh.
But
oops.
instead, we have multiple characteristics that shape our lives.
Okay.
Instead, imagine a population
Let's
represented
move.
on a grid.
I apologize. Let's start this over. All right, let's see where my screen is to share. Oh boy, this does happen every so often. Let's try.
And for those of us who are on the other side of young people that use all these technical things are a piece of cake for you. And here we are, your elders, trying to figure out how it all works. And the moment we think that we know, then something goes wrong, and you're sitting there going like, what? Why can't they figure this out?
Oh my goodness, thank you so much, Sandra, for that excuse. All right, I think we should be good here. Let's see. Does everyone see my screen?
You see your screen, yes.
Okay. Okay, let's keep going. Okay.
Research has shown us that gender, ethnicity, and social class have a strong impact on our health. Yet the simple fact is that no one is just a man or woman, or just black or white, or just working class or middle class. But instead, we have multiple characteristics that shape our lives. Instead, imagine a population represented on a grid. About half the population is female, half male, and some non-binary. And say 80% are white, and 20% are minority ethnic, and these groups have different social class backgrounds. Now we can ask, do these different resulting subgroups have different levels of health and disease, And if so, how can we explain these differences? Enter a perspective called intersectionality. Kimberly Crenshaw coined the term to describe the discrimination experienced by black women. She gave the example of a lawsuit against General Motors for not hiring black women. The company hired women and black people, but did not hire black women in particular. Crenshaw showed how sexism and racism combine to create a distinct type of disadvantage. This could be extended to other types of isms, such as ageism, disableism, and classism. Together, these different types of discrimination result in varying forms of advantage and disadvantage, which can lead to differences in health. To understand why discrimination is important for health, it's useful to think of the role of social institutions such as schools, hospitals, or the legal system. These institutions control who enters them and the experiences that they have there. Working-class children are underrepresented among university students, and black men are overrepresented in prison. Discrimination in the criminal justice system, the education system, and in society more widely is a key reason why we see such differences. In fact, any social institution, like employment or housing, can unfairly discriminate on the basis of multiple social characteristics. We know that social institutions are key determinants of health, and this helps to explain health differences based on gender, ethnicity, and other social characteristics. However, we do need to be careful and remember that people are hugely diverse. For example, white middle-class men are on average healthier than, say, black working-class women, but there is still lots of overlap between these two groups. This overlap is also important to keep in mind because experiences of sexism can unite all women, regardless of their ethnicity and social background. Racism, ageism, and other isms can also unite people to bring about social change. Yet, as Crenshaw showed, if we do not consider intersectionality, we may miss how interlocking forms of discrimination create new inequalities. So far, researchers and public health professionals have paid little attention to intersectionality. There has often been an assumption that one size fits all, and discrimination is rarely seen as an explanation of health differences. Yet we are now starting to see signs that more and more intersectionality is being taken seriously. To find out more about how you can incorporate intersectionality in your own work, please follow the links we have posted below.
Okay, thank you for listening to that. I hope that gave you some background that intersectionality is indeed a really important concept, not only for our social milieu and the social environment that we live in, but also for healthcare and how it impacts specifically on healthcare and people's outcomes. So as you know, Professor Kimberly Crenshaw is the one who coined the term, and I want to read this quote here from her in a recent interview that she did. She says, intersectionality is a lens through which you can see where power comes and collides, where it interlocks and intersects. It's not simply that there's a race problem here, a gender problem here, and a class or LGBTQ problem there. Many times the framework erases what happens to people who are subject to all of these things. So now we'd like to enter into a particular framework. I've been talking about intersectionality as a framework to understand this. And this social identity wheel has been used as a tool, especially for college students and others, to really understand how they themselves identify and what sorts of identities are present for you as a person, because really in this kind of practice as a healthcare practitioner, the more that you're aware of yourself and where you come from and what your biases are, and a lot of the way that you think about other people and the way that you think about social problems is going to inform how you practice, right? So this is a really important reflection exercise, but we're going to take just very few moments here, just a few minutes here to please look at this multicolored wheel called the social identity wheel, and just see the different types of identities there. And you can probably add many more in the multiple colors that this represents. This is just a really simplified version. So yourself at the center, what kinds of identities are really present for you in all the different ways that you are in the world. So just look at this list and be thoughtful about what is it that really, that identities do you think about most often? So we're just reflecting here. And maybe question number 2, which identities do you not think about much? Some identities that you carry, but you're like, yeah, okay, but it's not really central to how I live in the world, how I am in the world. I know for me, my cultural identity as a Peruvian American woman, cultural and gender identities both are that intersection that really defines me, and that's kind of what I think about the most. Other identities maybe not as important to me, but that's me. So number 3, which of your own identities would you like to learn more about? I'd like for you to be thinking about this. Okay, just noting what you are thinking about here. You could either write this down or just have it in your mind. I'm going to go to the next slide, which also has a picture of the wheel, so you're not losing that central note here. But here is something I'd like for us to look at. Which identities have the strongest effect on how you perceive yourself? And what we suggested is that in your own on your own tile, when you see gallery view or when you see all the different speakers and people here in the conference, you have a little tile, right? It has your name or it has your picture in it or yourself. You have 3 dots in that tile, and you can go ahead, as I have in my tile, you could see that next to my tile, I've changed my name to, typed in my name and actually typed in what is my identity that I'm most connected to on how I perceive myself in the world. So I've changed mine. It says Vicky Vasquez, Peruvian American woman. So go ahead and please change your tile. This is an opportunity to kind of be active with these identities for yourself to the extent that you're comfortable. You can also put them in chat. If you wanted to open up chat, go ahead and use that. Just go ahead and think about what is the identity that has the strongest effect on how you see yourself. Some people might put their first name and then their tribal affiliation, or maybe their first name and then their gender identity. So really important things to be thoughtful about on how you perceive yourself. Just take another moment here to think about this, to fill this out, to change your various identities. I'm not seeing anything in chat, so I'm assuming that maybe people are doing, looking at the participant list, kind of changing some things in the participant list little by little. Great. I see some of you have changed those names for yourself. And that's a really important practice to understand how you are perceived and how you perceive the world as well. Thank you. Yes, some of you have a lot of different identities, right? You have multiples, right? We intersect at all of those, and I don't like to be defined just as one thing either. So many of us we have a lot of different identities. So I'd like for us to move to the next slide, because I think this is instructive on how we hope to use this for our public health and healthcare practice. This is ultimately the reason for this conference, is to help you understand, what is in the future for you, what issues are important to know and learn about, and how is this going to influence how you move in the world, what you decide to do with your life in the world in healthcare and public health. So this is important. So question number 5 is, which identities have the greatest effect on how others perceive you? And the reason we've asked that question is because sometimes you can have a potential experience as a patient, and if others perceive you to be a certain identity, you might have a certain experience from that. If you are an identity, or you have a particular gender identity that others don't understand or find confusing or find offensive, or for whatever reason, that is going to be your experience. That is going to be your experience as a patient. People in healthcare are people just like you and me. They come from all walks of life, with all majors, etc. So you could have a particular experience as a patient. Alternatively, you could have an experience as a healthcare provider, having a certain identity that your patients see in you. You know, are they going to be influenced by your identity? Most likely, yes. I mean, we know this. This is how we are. We are very. Some of us receive in healthcare. It's just like any other environment. We're very influenced by perceptions and what we see. And hopefully, we can really do a good job to go beyond surface level and really understand deep what people are going through cultural humility. And I hope that's a concept that many of you will get into and study someday. I'll put it in chat because that is a really important one. Cultural humility. To understand, there are a few videos out there that are wonderful on this topic, and I hope all of you get to really delve in a little bit more to understanding yourselves and understanding others. I'm going to forward now here because intersectionality is becoming very important for healthcare. That video suggested as much, and The Lancet, which is a very important journal in medical science, health science, just published last year an article called Adopting an Intersectionality Framework to Understand and Address Power Inequity in Medicine. So this is not just a side issue that some people are concerned about. It's reached levels that we need to really seriously take into consideration. If you're not being taught this in school, that's fine. Educate your peers, educate your teachers. We also learn from our students, 100%. Definitely learn from students. So I have something here that I'm hoping you'll get this slide to see at some point when you revisit or see the recording, I guess, of this, or receive the slides on this. You can read this for yourself, but it really is about decolonizing medicine and public health. Because what we've done is we've come up with a culture of medicine and of public health that's very patriarchal. It's dealing with one type of identity that's in power. It's moving that and spreading that throughout the world as the only way to practice, when we know actually that people are receiving healthcare and public health and healing from practitioners that are not in medicine. So we need to really understand what it is that we're getting into, what kind of career we're getting into. So I hope you get a chance to look at this, but I wanted to leave enough time for my co-presenter, Sandra. So I'm going to forward this slide to her. And oops. Okay, we are in the realm of talking about characteristics and qualities of programs that address and really are formed to move into intersectional spaces and work with women, men, non-binary, and other, that really to understand what it is that they're going through and to understand how to provide services in a culturally humble way. So Rainier Valley Midwives is one program that I wanted to just out, and really for your own edification, many of you are in the Northwest, you might have a chance to intersect with this organization. But Sandra will have the next slide and talk about Mental Health Matters and all the wonderful work that they're doing. Sandra?
Thank you, Vicky. What a great day it has been so far on this conference, and I am so very proud of the work that has brought us here today. And I never had a doubt that our young people could put something like this together and do such a great job. I really enjoyed the previous panel. So, with that, I want to thank my co presenter, Dr. Breckwich Vasquez, and share with you a little more about Mental Health Matters of Washington. That is a new community center mental health promotion program here in Snohomish County, funded by Verdant Health, as well as the University of Washington, Bothell. And for those of you who have not had the opportunity to check us out, we are the primary aim of the Mental Health Matters work is to promote mental health and well-being in Snohomish County, Washington, eventually expanding our program outside of those boundaries, but to use tailored health education, community engagement, resource navigation, and social support as a way to take an active role at this moment in addressing some of our most urgent mental health needs. When we started thinking about this program, we knew very well that we could not wait for all of you who are thinking and health professions and maybe even considering mental health as what you want to do in the future. We knew we couldn't wait for that, so we needed to respond to the emerging needs of community, and that's how this program came about as a way of instructing as part of the many things that we're doing in this program to support community by using the promotora and navigator model to train lay people, young people as young as 14 all the way to seniors, to be those resources in community. So I would like to take a quick moment here and share a little video about what we're doing, and hopefully I will have the same luck Dr. Breckwich Vasquez had and get it to work. So here we go. So thank you for indulging me with that little video. And Dr. break with Vasquez, if you can go back to the slides, and we will have that shared. Basically, I wanted to present this program that it's about to complete its Spanish cohort here this week. We have done it English and Spanish as a start, and we wanted to use this as an example of the the way that we are using the concept or the framework of intersectionality to address the needs for our community. So, Vicky, can you share the next slide? And intersectionality, as it relates specifically to mental health, it's really important for us to understand and for us to recognize the difference in experiences of people of color, is specifically Black people. Dr. Knight, CEO founder of DISC, Culturally Responsive Education Services, explained that race-based trauma is a consequence of emotional pain that a person feels after encountering racism. And that racial trauma can be triggered by many, many events, but among the most common triggers are continued racial harassment, being a victim of policy violence, or witnessing violence. So it's important that we take into consideration the statistics. And as we are sharing here on this view, it's the percentage of people, it's particularly when we're talking about Black and brown people, specifically in this graph, the population that identifies as Black is 13%, but of those, 16% report having a mental health illness in the past year. And the fascinating thing is that we are just now, as Dr. Jen share in the previous presentation, starting to talk about this more, and that is because our young people are having the courage to share the ways in which this is impacting you and looking for alternative solutions to this issue. Next slide, please. So one of the things that I wanted to do with my short time in the presentation is just to share briefly here some of the activities that we have been engaging in, having roundtables, having mindfulness courses, and talking about gender affirming care and the intersectionality of trauma and addiction as ways in which we want to support our community in not only finding the perfect professional if they can, but also meeting people where they're at and using the resources existing and the ones that we can collaborate with in order to address the growing need for mental health services. Next slide, please. So now, what you have heard about what intersectionality is, how it impacts our everyday life, and for those of you in the medical profession or in the healthcare profession, what do we do now? How can we make that something that that is more real for those offering services, but that also we don't just get stuck on the part about diagnosing someone or offering particular services, but how we are thinking about using that intersectionality framework for everything that we do when we're working with others. So my brief suggestions for some things to think about is, number one, remember we need to talk about the challenges, discrimination, and injustices that our BIPOC, immigrant, and refugee communities experience when the U.S. healthcare system fails to support their multiple layers of identity and cultural beliefs. Ask yourself, how will you acknowledge the wholeness of the next person who comes into your office, your clinic, your community center. Remember that it's important that we put back the expertise on the client, on the community, and move the desk away. The idea that they're on that side and we're on this side, and decide to work side by side with whether you are a grassroots organization, whether you are a funder, a healthcare provider, a CEO in a corporation, that you trust that the community knows what's best for them. Remember that we cannot do the work without asking ourselves, who else is not here and why? Sometimes we have the same people showing up for the same meetings and they're all in agreement, and those who need to hear the message may not be part of the conversation. So we need to ask ourselves, who are they? And how can we support one another? Because in the end, we're all worthy, valuable, and we all deserve love and care and a chance to go beyond survival into thriving. So I hope that this framework and this example of mental health matters has given you an idea of how addressing on ways that are outside the box that can sustain the approach of community-based care for mental health. So with that, can I have next slide, please? Thank you. And I hope that you found this presentation meaningful. And thanks for listening.
Thank you so much, Ms. Vasquez, Ms. Huber, and Professor Early for an amazing presentation. It was very informative and a really relevant topic to discuss. So thank you.
Thank you for having us.